Hi students, we like to give a course for KROK-1, those who are preparing 2021 in the month of June, and the center of course teaching or the tuition we're taking is near to Escode, and those who are living in Subion Plus can attend in that course offline. Students who are in online, they can join also every weekend. In Saturday, we have 2 hours for teaching, and also we cover the previous years and its concepts. So let's start our discussion. This is a promo video and you can check it out, is it good or not, and you can contact with us in description link. I will add the phone numbers of the tutors. Okay, let's discuss with our first question. So the Coke step 1 is dramatically changed from every year. So in this year they giving us some concepts and the new patterns. And here is they said that the biosynthesis of purine nucleotides occurs de novo from amino acids. Name the amino acids that are used in synthesis of purine nucleotide cycle. So what they are basically, what is mean by purines it's nothing but it's adenine and guanine. It's these two are the one of the nitrogen bases which are present in the DNA. So basically purine nucleotide synthesis means that the synthesis of adenine and guanine formation. You can see the ATP and GTP. Basically the ATP and GTP comes from the glucose, and it undergo in HMB shunt, and we get the ribose phosphate. In ribose phosphate, we can see in the DNA the pentose sugar, and you can see 4 nitrogen in the ring of an intermediate species, and the 2 nitrogen compound are coming from the amino acid is glutamine, and one is from glycine, and another one is from the aspartate. You can see here. So they are asking what amino acid, name the amino acid used in the synthesis of purine nucleotide cycle. That is glycine, aspartate, and the glutamate. You can see here, right? Okay. A woman who takes an indirect anticoagulant. So anti means against, coagulant means clotting, right? So what happened here? The thinning of the blood increases, right? Increase the blood thinning, which means that there is a chance for hemorrhage. That's why they are saying that they developed intestinal bleeding. Okay. So what we can prescribe in this case? So when we consider the options, you can see the vitamin K or the Vicasor. Vicasor helps in the clotting process. So this is a simple question and you can answer, no problem at all. And all the questions are taken from 2020 October. This is the main concept they are asking. And if you know the concept, there is no problem. If you just studying by heart, it's very problem for you. So that's why we are like to help you. Okay, a foreign body in the airways. What bronchus should be doctor examine first while searching for the foreign body to extract it? So in infant, we can draw the trachea, the primary bronchus, right and left, in infant and also in adult. The deviation, the angle between the primary right and left bronchus is 45 degree, approximately 45 degree in infants, and they are same. It's not secondary, it's primary right and left, right? Okay, actually I made a mistake here. So in adult, what happens? from the trachea, we have the right and left primary bronchus. You can see the right is little bit straight, short and wider, but the left bronchus, primary bronchus, it's long and it is more deviated. Primary, it's not secondary, it's primary right and left bronchus, right? I will made a mistake, so I am going to erase that. So primary right and left bronchus. Okay, now you understand the concept, right? So what happens in adult? The primary bronchus is straight, short and wider. So when some children or adults ingest something, so primarily it gets into right bronchus. That's why the doctor examine first the right bronchus. So the right primary bronchus is straight, mostly or almost straight and short and wider than the left primary bronchus. So foreign body can enter into right primary bronchus very easily than left primary bronchus. Okay. Going to our next question. Okay, they said that some patient have type 1 diabetes mellitus, and previously his insulin therapy is very good, but last year what happened, he started to breaking his diet and taking insulin dose irregularly. So there is a big problem with this. So there be complications of diabetes mellitus can happen. So for example, like neuropathy, this is the damage for the nerves, and tingling sensation loss of will occur, and nephropathy, it is the damage for kidney and its glomerular state, and diabetic food, which means that the food will can necrotized in DKA, that is diabetic ketoacidosis. It leads to increase in metabolic acidosis and retinopathy. Okay, in nephropathy, what we can see, the glomerular filtration disorder. We can see the sign of glomerular filtration disorder. So for easy understanding, I'm going to draw a nephron and the glomerular apparatus. So this is our afferent arteriole. Just consider afferent arteriole is most larger than efferent arteriole, and it gets into Bowman's capsule and it becomes coiled, and eventually they become efferent arteriole. So in below I am going to draw our Bowman's capsule, and glomerular filtration occur in the Bowman's capsule, and you can see our proximal tubule, and primary urine gets into this proximal tubule. Most of the primary urine gets reabsorbed into blood, but this is not a point here. So in primary urine there be no proteins. Okay, some little bit small proteins can be present, but there is no larger proteins can be seen in urine. Okay, but what happened in nephropathy? Okay, the filtration will be disrupted. So the filtration will be disrupted. So what we can see, there will be so many pores in the blood vessel within the Bowman's capsule. So you can see large amount of proteins in the urine. That is mean that proteinuria. Okay, proteinuria can be seen in glomerular filtration disorders. Okay, proteinuria can be seen in glomerular filtration disorders. Okay, leukocyturia, which means that high amount of leukocytes in the urine. It can be seen in infection, and hematuria can be seen in cancer, nephritic syndrome, and also in trauma. But in diabetes mellitus, you can see the proteinuria. Okay, and the oxaluria, which means that it indicates the presence of stone in somewhere, maybe in the kidney, pelvis, or the ureter, anywhere. So cylindriuria, which means the presence of cast in the urine. Okay, before we go into discuss in this question, I am going to say that the metabolism of the galactose. Okay, metabolism of galactose. So the metabolism of galactose is very simple, and deficiency of this pathway can lead to galactosemia, which means that the high amount of galactose present in the blood. Galactose is initially converted to galactose 1-phosphate. Then galactose 1-phosphate is converted to glucose 1-phosphate. Okay, that is the metabolism. Very simple. 2 steps. So the enzyme which is converting galactose to galactose 1-phosphate is galactokinase. Kinase which helps in addition or deletion of phosphate group. Kinase enzymes. Okay. Deficiency of galactokinase, what can happen? Benign galactosemia. Galactose 1-phosphate to glucose 1-phosphate. Which enzyme? Glucose or hexose 1-phosphate. Uridyl transferase. Uridyl transferase. Okay, understand? Okay. Deficiency of this enzyme leads to classical galactosemia. Classical galactosemia. This is the most severe and most common presentation, and also in KROK exams most of the times they ask this pathology and this enzyme. So when you see galactokinase and glucose 1-phosphate uridyl transferase, just go with glucose 1-phosphate uridyl transferase. So what are the clinical classification or clinical manifestation of this disease? Okay, you can see in child the cataract and the mental retardation, and also the hepatomegaly. This is the clinical features. Okay, and okay, this is a promo video for students, and if you like this video, please share to everyone, and let them know we are taking a course for KROK, and the KROK questions are nowadays they change their pattern from when we come from the previous year to this year. There is a serious there is a change in the question pattern. So just understand the concept, then study. Don't by heart. Don't study by heart. It will not help for you. Okay. Thank you, friends. Bye.